And Dr. Jhinghan will continue, coordinate another 2 sessions. The next session is on aluminium toxicity, a new concept. And we have with us Dr. Harish Parashar. And Dr. Harish, I know him because he is my classmate from Wardha. And he is doing a lot of work in the field of aluminium toxicity.
So next topic is about the aluminium toxicity, and this is very important because most of the things which we have been using in our daily use, and some of these do carry the concern for about the toxicity part, and we have with us the expert. I'll request Dr. to start the talk, please.
Yeah, good morning, everybody. I'm here to present to you today about the aluminum toxicity and the role of sodium metasilicate in aluminum toxicity. So as we know, the basics of aluminium, it's a third most prevalent element in our environment available, atomic weight 26.98. Gastric acid and oral citrates, they favor absorption. H2 blockers, they reduce absorption. Transferrin is a primary protein binder. Normally our body, it tolerates around 20 milligrams of aluminum every day. But unfortunately, we use or we ingest much more than that. Adequate calcium intake, it may decrease the risk of aluminum, and the aluminum can be absorbed through lungs and skin. Talking about the various sources of aluminum, we have a wide range of items that we use every day, like processed foods, medications, the personal hygiene products. Aluminum is added as an emulsifying agent in processed cheese, in cake mixes, self-rising flour, and the baking powder. Aluminium lauryl sulfate is a common ingredient in many shampoos, and several anti-dandruff shampoos, they contain magnesium aluminum silicate. Aluminum is an active ingredient in most of the antiperspirants we use in our daily life, and it is as aluminum chlorhydrate. It is designed to be absorbed into the skin, and it's known to cause Alzheimer's disease, like 3-fold increase in the chances to have Alzheimer's. The maximum content levels of aluminum in the water acceptable is 50 ppb, and the water purified, which we normally use with multi-pure system, it contains 10 ppb. Coca-Cola Classic is in an aluminum can, it contains 6,160 ppb. So we can imagine how much aluminum we take every day. Many municipal water supplies, they are treated with alum and to get rid of the murkiness. But these studies show that use of aluminum in such drinking waters increases the chances of Alzheimer's. Many carbonated beverages, they are acidic, but analysis says that most of the beverages, they contain 4.5 times more aluminum than in the cans which are in the plain drinking water cans. So aluminum is one thing to which we are exposed too much in our day-to-day life. Beer normally, it helps in excretion of aluminum from our body, but when beer is packaged in an aluminum can, it substantially increases the load of aluminum on our body. Aluminum alloy cookware and containers, they are a big source of aluminum added to the food every day. The older the aluminum cookware is, the more rapidly it corrodes, more aluminum ions are released, and more damaging it is. Now I'm talking about sodium aluminum phosphate. This is an additive we use in the baking powder. And when this combines with maltol, a sugar-like flavoring agent, the resulting aluminum compound is able to get through the blood-brain barrier 90 times more than usual. Aluminum compounds are widely used in all additives to prepare foods like processed vegetables and fruit farmers just to lighten the food texture and adjust the acidity. Potash alum is used to whiten the bleached flour. Aluminium is even used in infant food formulas. And sodium aluminum silicate or aluminum calcium silicate are added to the table salt to reduce the absorption of moisture. Aluminum is found in many OTC preparations like over-the-counter painkillers, anti-inflammatory drugs, and the dose preparations. Aspirin is normally buffered with aluminum hydroxide or aluminum glycinate, and when this buffered aspirin is mixed with an orange juice, the buffering powder becomes aluminum citrate, which is able to get through to the blood-brain barrier 5 times more than usual. Most antacid preparations, they contain aluminum hydroxide, and they may contain up to 200 milligrams of elemental aluminum, and that's 10 times more than the acceptable levels of aluminum for our body. Aluminum is used in dental braces, dental amalgams, and in toothpaste as dihydroxyaluminum. So here are some pictures about the aluminum wares which normally we use in day-to-day life. All utensils, everything. Dental amalgams and braces and the toothpaste. Aluminum foils. Takeaway food packaging materials. The aluminum cans as the soft drink cans. Perfumes, antiperspirants, shampoos and anti-dandruff shampoos. Antacid tablets and the liquids. Aluminum coatings on the toys for the children, and the baking powder, and maybe the needles. So you can imagine how much aluminum we are exposed every day. I'll just quickly run through the studies which normally have been done on aluminum toxicity. It's like aluminum toxicity following intravesical alum irrigation for hemorrhagic cystitis and progressive encephalomyelopathy with muscular atrophies with aluminum powder. Some commonly unrecognized manifestations of aluminum related to metabolic arthropathies, sepsis, a cause of aluminum release from the tissue stores, transverse fractures in the spinous process. Is it aluminum related? Risk of aluminum accumulation in the patients with burns. Vaccination granulomas. At the site of vaccination, it has been found with aluminum allergy. Aluminum, a neurotoxin which affects the diverse metabolic reactions, and so on. So we have so many studies which confirm about the effects and side effects of aluminum on our body. Now coming to the symptoms part of aluminum, when the ingestion of aluminum is more than 20 milligrams, maybe up to 50 to 80 milligrams in a body every day, the symptoms which we normally see with aluminum is impaired body immunity. So it reduces the body resistance to various infections. Impaired iron absorption causing anemias, oral ulcers, esophageal spasm, chronic gastritis, irritable bowel syndrome, chronic constipation leading to proctitis and hemorrhoids, muscular weaknesses and bone pains, fractures that do not heal quickly, premature osteoporosis and the pathological fractures, spinal deformities like kyphosis and scoliosis, loss of memory,